It's The Journey with drug and alcohol attorney Mark G. Astor.
All right, everybody, welcome to another edition of The Journey. Don't forget to post comments and questions that you might have. Also, you need to go on YouTube, like and subscribe to the channel. You can follow us on Facebook, on my personal page, Mark G. Astor, and the drug and alcohol attorney page. And Jay, we're on a couple of other platforms now, right? Which ones are we on? iHeartRadio? The whole list. I got to get the whole list. But we're on other platforms now. We're spreading the word about what we do. And I'm very excited to have as a special guest Dr. Chaim Colen, who is a neurosurgeon and also is the founder of Inspire Palm Beach, which is a very state-of-the-art detox and substance abuse disorder treatment center. So I got him in here because I think first of all, he's an interesting guy, and I met him and we just sort of hit it off. But more importantly, he's a really impressive guy. I mean, brain surgery is no small feat, right? So when they say, "What are you, a brain surgeon?" You're like, "Actually, I am." But I think the whole getting involved in the treatment industry, I think, is great. And so I wanted to have you on as a guest and talk about what you're doing and
Mark,
anything else you might want to chat about.
Thank you so much. I appreciate being on the show.
I made you sound good, right? It's pretty good, right?
Yes. So I've been involved in building this acute medical detox facility in Palm Beach. We have been now on our second year in developing this clinical compound, if you were to say. Something that's very holistic. It's we look forward in helping people, not just circulating people through, but rather helping people. I think that's just as I am a neurosurgeon and I help people. So same clinical scenario.
So I want to talk a little bit about that because I mean it's not every day you meet somebody who's a brain surgeon, right? In fact, I think before we came on the show, you were saying you've been up for 3 days pretty much?
I have.
On call for 3 days.
On call.
You just got done with somebody who tried to, I guess, did shoot himself in the head,
Mm-hmm.
right? I mean, I would think that's exhausting emotionally work.
It was, and the thing is that unfortunately he didn't make it. So
I'm sorry.
That makes it even more difficult. But that's part of neurosurgery. That's who we are.
So how long have you been doing that? I mean, I know from my brothers that you guys have to do tons of medical school, right? Worse than law school.
Yeah. So I did about 17 years of training. So I went to medical school in Puerto Rico. Before that, I went to undergrad. Then I went to yeshiva. Then I went to medical school. After medical school, I came to Michigan. I did my residency in Michigan.
So we talked about that, right?
Yeah, we did.
Right? I told you to do my undergrad there.
Michigan,
I was probably having more fun than you, though.
A lot more fun.
Probably.
So I said in medical school, I learned how to drink. That was one thing that medical school, after your big exams, everyone always went out to drink, and it's interesting how people do that. I think one needs to learn how to drink responsibly. That is crucial. It's a crucial element, and not overdrink, right? And so always drink and be still within reason, right? So not getting drunk. So.
All right. So how long have you been practicing as a neurosurgeon?
So about 9 years, 10 years since my graduation. I graduated in 2009, but so I've been doing neurosurgery for about 12 years now. So it's been a while.
How do you choose? Because I know from my brother's perspective, he's an internist, but he got real passionate about being in the hospital when my father was sick for a couple of years, and he realized that his real connection with the patients was in that critical care stage, and that's where he wanted to be.
Something that I have realized is I enjoy the ability to quickly and masterfully understanding a person's condition and tackling the condition and rectifying whatever might be going on. So as an example, a neurologist would be treating a chronic illness such as seizures you can't really treat that. You can treat it with medication, but ultimately the patient is going to have seizures for many years to come, and you can't really do anything. Here, you have the satisfaction of treating the patient. So surgically, you can really help the patient. You can remove the area of the brain, as an example, that might be causing the condition, the seizure condition, and you have the instant gratification.
Well, I've heard that, there's very little, we're still learning a great deal about the human brain, right? What it does, how complex it is. I mean, it seems like in terms of medicine, that's a very evolving area.
It is. And so something is that we only know really about 10% of what the human brain does. Right? So we know all the motor tracks, we know the sensory tracks, we understand some of the logistics for the brain to operate, but we don't really know what the rest of the brain does. That is very difficult to understand.
I listen to a lot of audiobooks, and I listened to a great book recently by a guy called David Goggins.
Mm-hmm.
I don't know if you're familiar with him. The book's called You Can't Hurt Me. He's a Navy SEAL, but what's interesting about David Goggins was he went through the SEAL training 3 times because he got injured or sick, and the 3rd time, when they told him it was his last time, he basically went through it with broken legs. He had to tape his legs up every day, literally with like athletic tape. He went through SEAL training. He went through Delta training, the Delta Force training, and the Rangers training. He's probably the only guy on the planet that did it. And he's also known for doing all these ultra marathons.
Mm-hmm.
In fact, he did one of the marathons, which was a 100-mile race, almost on like a whim. Somebody said to him, I bet you couldn't do that 100-mile race. So he went over to like Kmart, bought a box of crackers and a thing of Myoflex and did it. I mean, he ended up in the hospital afterwards. But he talks about his training and stuff. And one of the things he says is he determined that when we think we're working at maximum capacity, we're really only at about 40%. Mm-hmm. We have 60% that very few of us can really tap into. Mm-hmm. And I'm thinking, you dealing with the brain, It's so
true. It's so true. And I feel that within the human psyche, something that's most important is probably grit. Grit and determination, and we can do anything. There are very few people that have the amount of grit that it takes to accomplish certain tasks. And whether it's becoming a neurosurgeon, and or it's finishing the detox facility, and or doing CBD cannabis related stuff. I sit on the board also for cannabis, so I'm very involved in some of these things as well.
So where'd you develop your passion for all this stuff, especially the substance use stuff?
So I had very close people that passed away. I also had several patients that I knew intimately that passed away. And I realized that even though they had been to several detoxification facilities, they were back and they were almost like in a vicious cycle, and they were not helped. And there was one individual in particular, he tripped and fell and he developed a brain bleed, and I went to the hospital and I saw him, and I was called in consultation. I didn't recognize the guy. I recognized his girlfriend, and it was very sad. Because I asked her, "What are you doing here?" And she said, "Did you not see who that was?" And I said, "No, who is that?" And she told me who it was, and I went back and I took a look at his face, and indeed it was someone that I knew. And it was very, these things really, they really jarred my internal mechanism, and I said, I could, as a neurosurgeon, I could do more to help. And that really got me thinking along the right track.
Yeah, so from what I've learned about what we do, in this industry, is they talk about the substance use and mental health, especially substance use as a brain disease. Mm-hmm. And seeing as how we have a neurosurgeon, I thought maybe you could shed a little light on that, what they mean by that, because a lot of the time parents, they don't always agree on what's going on, right? One parent says, if he or she wanted to stop, they could, and the other one understands it's a brain disease, and it's kind of like stopping having cancer. You really can't, right? So maybe shed a little light on that, because I think that would really help for us to understand.
Sure. So I feel it's very important to try to understand the root of the problem. A lot of times, how do they get into even addiction? how do they fall into that rut? And I feel that there might be something going on at home, and one needs to explore that, and one needs to try to rectify whatever situation might be going on. It's you can't just go and say, oh, well, go to an addiction center, become clean, and you're fine. We haven't discussed what problem it was that brought them into this in the first place. And we need to get to the root of the element of why they have that, whether it's a broken home, whether the parents are going through the divorce, whether it's not doing good at school. There's so many other elements that we need to explore. And I feel that this is a good rationale for trying to understand the root of the problem, and not just addressing the addiction itself, but rather the element that brought them to the addiction. It's kind of like a cancer. You can't just go and say someone has cancer, okay, so let's just go ahead and treat it with chemotherapy. Sometimes it needs to be treated in a multi-modality approach. So with chemotherapy, with radiation, with surgery. So we need to explore.
Okay. So setting aside like why somebody starts to use, let's talk about once they start to use, why they can't stop. Or appear not to stop. I mean, I get them, the families call me when we're sort of, I had 2 calls this morning. Both kids had been Baker acted, in the last 24 hours, and now they're afraid they're going to get out. So we're sort of, in that rapid response mode, trying to get a court order.
Mm-hmm. So I am not entirely familiar as a neurosurgeon on those aspects as to why they fall into this rut. I think one should explore very carefully why they are in this to begin with. Whether it might be someone who is addicted to a drug, whether it's opiates, whether it's alcohol, but why are they addicted? One can blame brain disease and say, oh, well, it's because they have a part of their locus coeruleus or part of their brain that is hyperactive. But something, let's explore why that is the case. It's very important to try to understand a little bit more what the root of the problem might be.
Okay, so, and I remember when we first met a while back, you told me about the whole CBD thing. So let's talk about that, because that's an interesting topic, right? Because there are some people say, oh, marijuana is a gateway drug. And we certainly see here in our office our share of children. I use that word generically because having a Jewish mother at 52, I'm still a little boy. You know how that feels, I'm sure.
I know.
Right?
Uh-huh.
So, we're typically talking about young adults, 18 to 30, but we get a lot of young adults who are, self-medicating with marijuana and delusion, paranoia. They think the FBI or the CIA is watching. Very consistent pattern. So there's sort of that view of what marijuana can do, and then there's the other side of it where, I've even seen, there have been some stories recently that have been coming out where they're saying that CBD could be used to actually treat a substance use disorder.
That's right.
So
it can be. And the rationale there is because CBD can be seen, and especially broad spectrum CBD, so I'm not referring to isolates, rather broad spectrum CBD, specifically CBN, it can be used.
What's CBN?
CBN is one of the cannabinoids, the endocannabinoid. It's part of the endocannabinoid. So there's CB1, CB2 receptors, the different types of receptors in the body. These are the most commonly known. But I would say that the hemp-derived CBD, so in other words, that has the medicinal effect, not the THC. So I don't want to lose anyone here.
No, we're good. We're good.
Okay. So THC is what gives you the high, right?
Okay.
So, and that is from marijuana. Hemp-derived CBD, right? So you can derive CBD.
So the hemp plant is different from the marijuana plant, right?
Yes.
Because the hemp, from what I understand, even hemp has been legalized. There's no federal ban on hemp. It's the marijuana that's the issue.
Correct.
So,
it's the THC.
Right.
Mm-hmm.
So I was also under the impression that what made the sort of medicinal function of it work was the combination of the cannabinoids, the CBD, and the THC, even if it was low level. But from what you're telling me, you don't need the THC. It's just the CBD or
Correct.
CBN.
Correct. And I would think broad spectrum. How it works is, so you have marijuana, which is typically high in your THC levels and lower in your CBD level. And hemp, it's the other way around. So CBD is high and your THC level's low. By federal standards, it needs to be beneath 0.03%.
Right.
Or, 0.3%. Yeah.
Okay, so
in order to qualify as hemp-derived cannabis. So both are from cannabis sativa.
So for medicinal purposes, do you need cannabis, or is hemp going to do the trick? Or there are certain things that the medical marijuana can treat, like cancer and seizures and things like that the hemp can't treat?
It can't treat because it's a CBD. So the cannabinoids. The cannabinoid system is what is the medical side of the hemp plant or the cannabis plant. And then you have your THC, which is what gives you the high, for the feeling of getting high. That's the difference between one and the other.
So tell me what your involvement is with the...
So we have a lot of acreage. We're growing hemp on large-scale farming in the Midwestern states. So that's what we do. And I really can't divulge exact locations of stuff, but we again, large-scale farming. I can show you a video of what we do, and we grow a lot of hemp, and it's specifically for the medicinal effect, nothing to do with cannabis.
Right.
We do have a third-party testing lab.
Well, I was going to ask you about that.
That's right.
Because I see the...
We were recently on the Dr. Oz show.
Well, I like that.
Yeah.
Okay, that gives you some credibility. But it's interesting. I see people advertising CBD all over Facebook, and I'm like, okay. And they say, oh, Al's treats this and Al's treats that, and I'm like, okay, how do you know that? And what's the difference between what your CBD that treats seizures and his CBD that treats seizures? Who's there to regulate it and say, yeah, you know what, this is good stuff and that's not?
That's
how
correct.
Do we know that?
Who even says there's CBD contained inside the product? And so we were on the Dr. Oz show, and we were brought 13 different brands. We tested the brands, and 5 of them had CBD. The others did not. Zero CBD. So very interesting.
Wow. Okay, so you said you have a third party that's...
Third-party testing lab, Nascent in California,
Okay.
LA, California.
All right, so you're doing your homework.
Yeah.
Oh, you're a doctor. So what do you think about in terms of using the CBD to maybe treat addiction?
It's useful. It's very useful, especially with treating seizures. And do we know exactly how it works or which endocannabinoid it's working on? Not really. I don't think we know at this time. Do we know that it prevents seizures? Yes, we do. Could it be through its anti-anxiety effect? In other words, the ability for it to be able to relax the person? Could be. We don't know. I think it needs to be studied a little bit more.
Okay.
I can speak on the CBD side. I know that this was one question that may come up, that may arise.
Right. So I think the issue is, obviously, if there's first of all, does any of the CBD have any level of THC? Because obviously you have legalities and stuff, and if you have somebody potentially who's on probation or might have a positive drug test through work or anything like that, if there's any sort of legalities that are involved with potentially treating somebody with a CBD oil. And actually, I presume it's an oil, right? We're not smoking this stuff.
Yeah. So again,
Jay's laughing, but no, seriously, that's why I asked.
Yeah.
You see things like gummy bears and all kinds of crazy stuff advertised on Facebook. I'm like, really?
Yeah. So no, CBD, gummy bears, anything that's pure CBD that is within the regulatory standard, in other words, that has a THC level of below 0.3%, it's fine. If it's above, that's when there's always a concern of, did something else happen that we might not be sure of?
Right.
In other words, were they smoking marijuana, or were they taking THC positive gummy bears or things like this?
Yeah, so what happens if somebody comes in and you obviously conduct some kind of drug testing, whether a UA or something else, and they already have THC in their system, and maybe they're self-medicating, right? I mean,
you never know. And I think something to explore in this particular case is why. So does this help to calm them down? Why are they using THC-based products, and try to understand what's going on there?
Okay. So let's talk about your new place that you're opening up in West Palm, because I know that's.
So I think something that we're going to use there is CBD, because of its anti-anxiety effects, and there's definite evidence to support the fact that you can use broad spectrum CBD to help patients to combat addiction.
Okay. I want to talk about your place. I know you have other things you want to talk about, and we're going to get there. I almost want to grab your list and see what your girlfriend put on there for us. She should have sent me a copy too and said, Mark, make sure you cover this with Chaim. It's so good. This is why we enjoy doing this, because it's relaxed. But I want you to talk about your place for a second, your new place, because I know you guys have been working on this for quite a bit of time. It's not a small facility, right? It's like state of the art.
So again, very state of the art, something that is very spiritual, a very organic feel. We are going to have the state of the art treatments, again, including CBD. We're going to have infrared. We're going to do brain mapping. We're doing several different modalities for treatment.
Okay, so tell me what brain mapping is, because that doesn't sound like something that I'm seeing at a run-of-the-mill treatment center.
So brain mapping is where we can evaluate the activity in the brain and see if there's certain parts of the brain that are more hyperactive and should be more quiescent versus other parts of the brain that are less hyperactive, and or if we need to stimulate certain areas or decrease stimulation on other areas. And this can be accomplished through the use of drugs.
Okay, it was interesting. We were at I don't know if you're familiar with NAMI, I think it's National Association of Mental Illness. They had a symposium down in Broward a couple of weeks ago. There was a doctor I think he was a psychiatrist on the panel, and he was talking about, I've heard him talk before, and one of the things he talked about was the fact that, with medications that are used to treat, anxiety and depression, those types of medications, that one size doesn't fit all, and what works on you may not work on me, and it might work on me for a little while, but then it might stop. And he said they are able to do some type of genetic testing to figure out what medications my body would even accept, as opposed to just sort of excreting it.
So I am not 100% sure if that's what you're referring to, but there's something called pharmacogenomics.
That's what it was, genome, right? That he mentioned that. Okay,
pharmacogenomics. And you can test if someone is a rapid metabolizer versus a slow metabolizer. In other words, that they metabolize the drug very rapidly in their body. Some people will metabolize drugs more slowly. If we know that someone is a rapid metabolizer, maybe they need a little bit more of a particular drug to calm them down versus a lot of drug. So if someone is a slow metabolizer, you should give them less of this drug, right? So we want to know which drugs are they metabolizing rapidly, which drugs are more favorable to their body, and we can pinpoint their treatments based on that as well.
I like it. Okay. So when's your place opening up?
We were scheduled for a soft opening sometime in June, but I think this is going to be delayed a little bit. There's so many things that need to go inside this place, so I'm thinking something along the lines of like 2 months from now we'll be open.
Okay, so I know that you guys bought a building, right, up in West Palm Beach?
Yeah.
Okay,
we bought a building.
Okay, and it's not just like a little
and
building.
And it's a beautiful building. We've been working on this very, very hard. I will share some images with you. Again, that very organic feel, something like the One Hotel down in Miami. That's the feel of the place. So very white, very airy, very light. It's a very different feel from most places.
So what kind of clients are going to be coming there? I mean, is it people who have dual diagnosis? Are there any people who have strictly mental health issues? Tell us about that.
So we're looking at clients that, one, that are professionals. That's one. Athletes, celebrities. We're also looking to cater to anyone that needs assistance. We're also building a 501c3, a nonprofit organization associated with Inspire Palm Beach that will enable us to treat people even if they don't have insurance. So the interest is more on helping people and not necessarily just focused on bringing in someone because of their insurance policies or not.
I like it.
Mm-hmm.
Okay, sounds like it's going to be really spectacular.
It is.
It sounds like something right out of South Beach. So,
well,
come on, what did Esty?
Esty,
She
yeah.
gave us a list of things that we have to talk about, right? So I don't want to disappoint. Infrared saunas. Well, I might have to come for that then. So I'm told that infrared saunas is phenomenal for treating
The
detoxing,
addiction.
right?
Yeah. Well. I think the jury's out on that. We need to evaluate whether infrared saunas we're definitely purchasing 2 infrared saunas, one male, one female. How much that is going to assist in addiction, it still remains to be evaluated. So there's a lot of studies suggesting that yes, it can help. I also think that just simple rest can help as well. Detoxing that.
Yeah, that's not one of my strong suits. And you can't do this kind of work and just be like, I'm going to rest.
Yeah,
it doesn't work that way.
It's true. And a lot of individuals that have the addictive type personalities are already a little on the hyper side. So that's why I think that CBD can be of assistance. Instead of giving them more drugs, give them something that's natural. Treat things naturally. Treat through psychiatric interventions and not necessarily just considering it's more of a holistic approach instead of
okay, so when you say that, do you mean because my brother actually he was a holistic medical practitioner before he went to med school,
mm-hmm.
and he said one of the things he found frustrating even during his residency was the new doctors were very quick to be like, take 2 of these and call me in the morning.
And you
right?
call me, that's right.
But did you find out did you get any history? Did you find out what's really going on here as opposed to just take a couple of pills?
Mm-hmm.
And so that to me is sort of.
And that's very true. I feel that a lot of places are just more, again, focused on the addiction itself, curing that addiction. So in other words, someone can go through rehab multiple times and not really solve the issue. And I feel what's very important is trying to resolve and trying to get to the core of why they're in this type of issue.
So what levels of care will you have there?
So the top 3, we're looking at acute medical detox, IIP or intensive inpatient, and then residential 1. So those are the top 3.
So what's the difference between IIP and residential? I never heard that.
So IIP is intensive inpatient. Typically, you're going to see your pregnant female who's going to qualify for IIP. Your residential
So
1.
somebody who might need medical care as well?
They still need some medical care. They still need to detox fully off whatever they're on right now.
Yeah, it's interesting you said we just had a case with a young lady. She's 20 years old, 3 months pregnant, and we had a really tough time placing her somewhere. There's very few places that will take a pregnant woman,
Mm-hmm.
especially that young. And
So we have two separate wings. We have a wing which is male, and we have a wing which is female. The idea is to separate both male and female. I think we need to focus during that period of time on getting better and not necessarily on having sex. I think that's very important to really separate both these parties.
I think that's a very good idea, and occasionally that issue happens.
It's true. It's true. It's true, but one can do your best to rectify those situations.
So what about aftercare in terms of, because it seems to me, a lot of the people that we know in the treatment industry are in recovery, and the ones that do really well, that are 5-10 years out in recovery, it seems like they are constantly working on their sobriety, right? Mm-hmm. They have a sponsor, they go to AA, they go to other programs. I mean, they're like, really, I have such respect for people who are, who've gone through that and are in recovery, because there's not just the personal growth, but they just continue to work at it. I'm always amazed. So, I mean, talk a little bit about what an aftercare program would look like.
So we would not really be involved in that aftercare. Important part for us is to make sure that they go to a good aftercare program. Aftercare is what is going to facilitate them getting better. A lot of times, if they don't have a proper aftercare program, that's when they can relapse. So making sure that they're in the proper environment, that they're in a proper program, whether it's an IOP or PHP program, that they would get the help they need. Okay. So we're on that medical side, where we would provide the acute medical care, and afterwards, just like I see a patient, that would be referred to me from the primary care physician. So my goal is to assist that patient in the acute phase, and afterwards make sure that they go back to their primary care or whoever they were referred from, and they would continue to get the proper help that they need.
Did we miss anything? Don't your girlfriend call me up telling me I did a lousy job interviewing you?
No. It's all good. No worries. I'm probably more tired than anything here.
I bet you are. Oh my God.
Yeah. I appreciate you taking the time, for sure.
I was glad that you came on, and I'm getting the big guy next. Don't worry. He's coming on next with his wife.
Oh, good. Yeah. You can capture any other things that I missed. I'm sure Tony knows. Tony, he's well aware of,
Pull your mic a little closer so we can hear you.
Oh, sorry.
It's okay. It's okay.
Other things that can be useful in the treatment side, especially from that psychologist, psychiatric perspective.
So I know one of the things just from meeting Tony and his wife is that I know you're putting together an amazing team there. Yeah. That to me is very evident.
Well, I definitely appreciate Tony, so thank you.
All right, folks, so thanks for tuning in. Don't forget to follow us, like us, YouTube, Instagram, Twitter, all the other social media profiles that I know Jay is putting up for us. If you have any questions, you can find us at drugandalcoholattorneys.com. You can email me, mark@drugandalcoholattorneys.com, or you can call us, 561-419-6095. Chaim, thanks for coming on the show.
Thank you.
You're welcome. We'll let you go home and get some sleep. You must be exhausted.
Yeah, I am. I am very tired.
All right, my friend. Thank you.
Thank you as well. Thank you.